I want to play this soundbite, Charles, from last week when House Speaker Nancy Pelosi, 2 days in a row, tried to get to the point of whether there will be a government-run option or not.
We will have a public option on the bill. Let me say it another way. We can't pass a bill without a public option. If they want no public option but a trigger, you can be sure that the trigger will bring on a very robust public option.
So Wednesday it was we have to have it. Thursday, maybe a trigger will work, but it'll lead to a public option.
It's a perfect example of the incoherence of the Democrats on all of this. And she's reflecting the president's incoherence. Look, on the one hand, here we are 8 months into this administration, 3 months into a really active, vigorous debate on health care. And 2 days before the president's great speech, nobody has any idea what's in it, and even he probably doesn't. So on the one hand, he's saying we're in a crisis, we have to act, it has to be done by last August, and then he doesn't even know, as of today, what it is, and he's asking immediate action on something that he doesn't even know about. That's number one. But secondly, underlying all this is an unease about his intentions. Obama's a man who believes in a government-run system. He said that several years ago. He's now disavowed it. But clearly people understand that the public option is a way to achieve, ultimately, a government-run system.
But a single-payer system.
A single-payer system. But he can't admit it because in America it's not going to happen. He himself had said that tactically you can't be in favor of a single-payer system. He also says he'll never talk about rationing, but he said it in public, he said it in interviews, he says it in private, troubled about the hip replacement his grandmother had when she was very sick and ill and terminal. He clearly thinks about rationing, he thinks it's important, but again, he can't say it. So in his heart of hearts, he believes in a national system and he believes in rationing, but he has to deny it, and that's why people worry about incoherence and disingenuousness.
Fred.